You're watching Iowa Live. Everything local, entertaining, and meaningful in Central Iowa is right here on Iowa Live.
From the Carl Chevrolet Studios in West Des Moines, welcome to Iowa Live. I am Lou, and folks, did you realize that 24 million people are suffering from neuropathy right now? And of those people, about 30% of them have it related to diabetes. Well, we have an expert in this town that not only can identify peripheral neuropathy, he can treat it. He can make you feel better. And he is Dr. Josiah Fitzsimmons from Vero Neuropathy. Dr. J, great to see you again,
Thank you.
sir. Now, there are so many different causes of neuropathy. We mentioned diabetes, one of the most prominent ones, but the question is, you might have this, where does all this pain come from? Because it is debilitating for a lot of people.
Absolutely. You mentioned diabetes as one of the top causes of neuropathy. You know, over 24 million Americans with neuropathy. It's a staggering number that have it. For most people, it's chronic levels of inflammation for long periods of time, starts to deteriorate that outer coating around the nerves. With neuropathies, high blood sugar, with diabetes, you know, whether it be from chemotherapy, whether it be from radiation, whether it be from taking different statin drugs, those can all deteriorate that outer coating around the nerves. And that's when those electrical signals that are supposed to be insulated between your brain and your body are no longer insulated. And that's why you start to get the numbness, tingling, aching, burning sensations in your hand, legs, and feet.
I see the list that we have up on here, and there's some that I didn't realize before. Autoimmune diseases can affect it as well. You know, nutritional deficiencies can also be a factor in this. So really, just a wide array of things that could cause this.
Absolutely. There's over 100 different diagnosed causes of neuropathy. So a lot of times it's not just one thing, Louis, this cumulative effect
It layers
of all these
itself,
different issues over the course of many, many years. And that's what neuropathy is. It's a progressive degenerative condition. It's just going to keep getting worse and worse and worse, harder and harder to do something about it. Once someone gets over 80% nerve damage, typically it can't be fully reversed. And that's why it's so important to get in sooner rather than later.
Okay, now another thing that's really important is you have to verify that neuropathy is a condition that you have, and you need medical tests for that, right?
Exactly. Most people for neuropathy, all they do is just touch your hands, touch your feet. Can you feel this? Can you feel that? We actually do 8 different individual tests to calculate the exact percentage of sensory loss in the hands or the feet. We want to know exactly all the different nerve fibers, exactly what's going on, so we can know exactly what stage of degeneration, what stage of neuropathy that you're in, so we know how treatable is the condition, what's the best case scenario, and come up with an individual custom plan for every single person.
Why is it so hard to identify?
Well, there's lots of different causes of neuropathy, first and foremost. So it's like, well, why did this happen in the first place? What are the different types of nerve fibers that are getting affected? And then we need to figure out, okay, where do we need to start working on first? Do we need to work on the blood flow? Do we need to work on the nerve supply? Do we need to work on decreasing the inflammation? We want to come with a customized protocol that's going to get the best individual results, no matter how the neuropathy has occurred or how or what level it's progressed to.
Now, we have somebody here that has some comments about the success that she had at Vero. Who's this?
Yeah, this is Dr. K, who's had amazing success with our neuropathy protocol.
Primary problem I presented with was difficulty sleeping. I mean, neuropathy would wake me up 2 or 3 times every single night. Now I can count probably twice in the last several months where that's happened. So that's significantly improved. So that was the primary reason. All the others I consider kind of added benefits. But I can stand a little bit longer, and I could walk a little bit taller, a little bit stronger, I guess I would say. But definitely sleep better. And a couple other things, I have really, really high energy level anyway, and it's even increased my energy, and I can't even believe I'm saying that, but.
Oh, I just love the fact she has more energy. That is great to hear. And maybe you are showing some signs that we've talked about now. And what can you do about it? I think getting involved and taking advantage of the $37 special you have right now is the way to go. That's the first step, isn't it?
Absolutely. $200 off. Meet with one of our 9 doctors one-on-one. We're going to do 8 different individual tests. We'll calculate the exact percentage of sensory loss that's going on. We're in network with most insurance companies, Medicare, Blue Cross Blue Shield, United Healthcare. We'll do a free insurance verification on your very first visit. Then we're going to come up with the comprehensive plan to improve the blood flow, recreate that coating around the nerve, decrease the inflammation, allow all the nerves throughout your brain and body to communicate properly. We don't want to just throw gabapentin or Lyrica or different drugs or surgeries at the condition of neuropathy. All these things do is just mask the symptoms. They don't actually correct the cause of the issue. We want to actually get the blood flow improved. We want to get the nerve supply. We want to get long-lasting results so you can enjoy the quality of your life, not just continually be held back by your health with neuropathy. Long-lasting correction, that's the goal, not just short-term relief.
So you saw that lady making a phone call. You know what number she was calling? She was calling 515-335-VERO. I saw her dial it. So 515-335-VERO. And when she did that, she got a hold of Dr. J's office from the Vero Neuropathy. Made an appointment. How long does it take to get in if somebody calls?
Typically, we can get people in, Lou, within 24 to 48 hours, and we have 9 doctors. We're literally right off of I-35, Mill Civic and 50th Street in West Des Moines. Super easy to get to. Right now, we have over 30 people a week that travel over 2 hours.
That's awesome.
One way, Lou. No, people don't travel that far unless they get amazing results.
Dr. J, great job as always. Thank you so much.
Thanks for having me.
When we come back, we're going to show you who creates all the great merchandise at Knoxville Raceway and a special deal going on this weekend. That's next.